Hello, I'm Anam Sheikh from Pune Times Mirror, and we are at Oyster and Pearls Hospital, Shivaji Nagar, soon to be in conversation with its director, Dr. Amita Phadnis. Dr. Amita Phadnis has a vast experience of over 30 years and is one of the best and foremost pediatrician and neonatologist across Pune and Western Maharashtra. Let's delve on her journey, expertise, and insights on pediatric healthcare.
ONP Hospital in Pune is a renowned healthcare provider committed to delivering personalized, high-quality care for over 60 years. The Department of Pediatrics and Neonatology offers state-of-the-art services including neonatal and pediatric intensive care. Dr. Amita Phadnis, Director of ONP Hospital, has a rich experience of over 32 years in pediatrics and neonatology. In 1992, she set up the first tertiary-level neonatal ICU in Pune called Neo Clinic, equipped with specialized pediatric, and the Pediatric and Neonatology Department of Oyster and Pearl Hospital has its credit to the smallest surviving newborn baby of India. With various initiatives for women and child health, she is a torchbearer of pediatric care in Pune and Western Maharashtra. ONP hospitals are dedicated to making a difference in healthcare by providing accessible, affordable, and compassionate care.
Hello, I'm Anam Sheikh from Pune Times Mirror, and we are in conversation with one of the best pediatrician and neonatologist, Dr. Amita Phadnis. Hello, ma'am.
Namaste.
So, ma'am, as we start, please talk a little bit about your background.
So as she said, I'm Dr. Amita Phadnis, pediatrician and neonatologist practicing in Pune for the last 30 years. But I grew up in Bombay, in Mumbai, and it was a nuclear household, and I think what I got from my parents was a golden childhood. By golden childhood, I mean a childhood which had freedom, happiness, and unconditional love. And I think through those growing years, जैसे हम कहते हैं ना कि संग का रंग, तो ऐसे में काफी सीखते गई. I learned a lot from that family life. Now, if I have to go back and evaluate, I really understood what a happy family is like, what a functional social society is like, what a harmonious marriage can be, where there are no conflicts. Because I was the youngest child and the older children had left India long back, I grew up as a single child, but in a very gender neutral background, which means I grew up with the liberties, freedom of a boy and with the trust and the responsibility with it. And that, I think, brought out the streaks of independence and leadership in me. So all this put together, and yes, of course, I understood what parenting is all about from my parents, because that, I would say, was a golden parenting. So this is where I come from. And then, of course, I grew up in Mumbai, I studied there. So great family life. And it works wonders for children when the family life and when the growing up years are beautiful and full of happiness. That's what I would say to you.
That's so nice to hear, ma'am.
Yes.
Okay. And ma'am, are there any life-altering instances you have encountered?
Yes, of course. Many, but I would say, pointing out to a single incident, in the year 2000, we had a very major car accident wherein our van got hit by a truck from behind. The truck went back and hit us again. And I found myself crumpled near the driver's seat. And one of the good things that I was a doctor was that I realized that I had broken my neck somewhere. And I just rested myself and I went on to bed rest for 6 weeks with a crack in my spine. So I think that was something, let me say, I was saved from death or from being quadriplegic. That means loss of control of all 4 limbs just by a millimeter. And that, I think, altered my life in the sense I started looking at life in a different way, having gathered, like I said, a lot of things from different people I have related to through my life and through many gurus. So that was a life-changing incident for me. Even now, if I think of it, I have goosebumps on my skin, just thinking about how I lived through those few months where I was on bed rest with a traction and I couldn't move. And of course, I'm grateful for my numerous caretakers who took care of me during that time.
So, ma'am, what are some of the most prevalent health concerns affecting children today?
So, obviously, we know all the illnesses in children, which is the pneumonias and the diarrheas and so on and so forth. But prevalent, you would say, and which are commonly we see, I will single out 2 of them. One is a large number of children come to us because of recurrent cough and cold. So I wanted to taking this platform to assure parents that Yes, a lot of children go through that. In the first 2 years, having a cough and cold almost 5 to 6 times a year is okay. But the important thing for parents to know is when to worry about the cough and cold. Because all of us know that a little bit of cold and cough here and there takes care of itself. In the past few years, I think pollution and a larger number of viral infections have contributed to the increase in incidence. So my message to the parents would be, if your child has a cough and cold which is lasting beyond 2 weeks, or I would say more than 7-8 days also, yes, you should meet the doctor. If your child has very high fever and is looking very sick, if your child is breathing very fast, if your child has what we call as intercostal retraction, that means the chest is being pulled in, you must seek the services of the doctor and don't delay it. And like I said, sometimes we also see children who are not that sick, but who just have a little fever, little cough, which goes on for maybe 10-12 days. Please do not ignore it. So recurrent cough and cold is one of the things. And I'm going to mention here constipation. This is something that nobody likes to talk about, but is very, very common. And as we know from our Indian tradition of Ayurveda, having a clean gut, a clean colon is very important for good health. But I have to literally ask the patient again and again, are the stools normal? Does the child pass stools every day? And then reluctantly they'll say, ho doctor. And sometimes they'll say, yes, but it is our family tendency. So what I want to share with you is constipation needs to be treated. And we do it very systematically and scientifically to train the child towards good gut habits. So it requires training. And one small thing I would mention here is the Indian style of squatting to pass stools is the correct style, because that gives the child the correct pressure on the abdomen. So I can go on and on about it. Tell me how much you want me to talk about constipation. So because it's something that I treat regularly,
Yes.
and I can vouch for myself that the treatment works, provided I think the parents need to accept that the child needs treatment. Where the parents falter is that they give whatever I've told them for maybe a few days and they'll say, nahi, yata, everything is okay. So that is the faltering, because sometimes constipation, which has been going on for years or months, needs 2 to 6 months to really put on track. All right. So these are a couple of things that I would mention in prevalent problems.
Okay. Ma'am, how do you approach communication with children and their families regarding their healthcare and treatment plans?
I think the first thing is, if you see my OPD, it's very child friendly. It's very highly, too much colorful and decorated with all kinds of sundry items, from toys to little chairs, to little wall hangings, to whatever. Just so that the child comes in and is a bit distracted when they see the entire mahal. So I would say one of the key things, and I think parents are also happy with that mahal. So that mahal or the environment is one of the key things. Second is, of course, like Vidya Balan said in some film, entertainment, entertainment, entertainment. I would say here, when it comes to treating children, history, history, and history. It's very, very important for the doctor to get the correct history from the parents. So we spend a lot of time on that. And of course, physical examination. I think in today's fast-paced world, sometimes doctors also cough, cold, they'll just write a medicine and give you. No, not the correct thing to do. And I believe in a 5-pronged approach to good health. So the communication is with respect to history. Then there is a physical examination. Then there are lab tests and diagnostics as recommended by the doctors, which is us. Then there is health information. And then there is health counseling. So a lot of paraphernalia or a lot of peripherals go into creating the correct communication strategy. So I always have an assistant doctor who's also talking, my nurse who's trained in Pediatrics Neonatology. So all of them talk to the patients and give them more comfort. Yes, does that answer your question?
Yes,
Thank
definitely.
you. Thank you.
Okay. So in your opinion, what are the big challenges that pediatric healthcare is facing?
I would say physical health, of course, like I said, there has to be a 5-pronged approach to good health. But I would single out a few things such as gadget addiction. I'm sure all of you would agree that adults and children are addicted to gadgets, and all of us have our phone on even as we are talking. So sometimes even when the parents are near me, dad is on the phone, tuck 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 tuck, and the children are no different. So gadget addiction, I think parents must be careful. Sometimes parents are proud ki my 2-year-old child is using the iPhone, and he or she is using it correctly. She knows even how to send a WhatsApp message or whatever. So no, don't be proud of that. Gadgets are not in limited use. Obviously, we cannot do without gadgets today. We all know that. But these are um, brains which are growing. And at some point, I'll share with you all a WhatsApp forward which showed what the gadget addiction is all about. The child goes crazy if you pull the gadget away from him. So, gadget de addiction is becoming a requirement for today. And along with that, I would say prevalent is also, or a challenge is ADHD, that is attention deficit hyperactivity disorder, becoming increasingly common. These children can't sit still for a moment. They are all over the place. And why is it important? What I tell the parents, I will tell you. If their attention deficit is not taken care of, the problem is their concentration and focus in their learning years is a problem. So your child may have a great IQ, may be very smart, but he or she will just not focus. And I can tell you, I have had parents meeting me when the child is 8 years, 9 years, and they said, Doctor, I wish I had listened to you when you told me that your child is hyperactive. Remember one thing about parents, they don't like being told anything negative about their child. So again, for them to accept it, and they sometimes take years in accepting and lose crucial time in addressing ADHD and increasing incidence of autism. Yeah, all of you will have heard, and these days when parents come to me, they've already Googled autism. So they're stressed. So they're like hyper. Does my child autism? On one hand, they're crying. On one hand, they're stressed because they see what autism is all about, disastrous effects on that. So I think these are the few things that I would say that are becoming a challenge. And I think we need to create a better and better infrastructure to handle it, and better preventive strategies through parent education to prevent gadget addiction and to pick up ADHD, as we call it, or autism early. If you pick it up early, treatment is really effective and you can see them normal after a couple of years. Yeah, but the treatment is challenging because it requires sessions, time, money, investment, but it has to be done, right?
Yes.
Okay.
So, ma'am, what advice do you give to parents to ensure overall well-being of their children?
Good question, but could be a long answer. So I'm going to try and make
No
it
worries.
short. So here's the thing. All of us, and I mean this for the entire audience, is that we must know what is the WHO definition of good health. WHO definition is one of the most beautiful definitions of good health. It means good health is not only absence of disease, but it is the complete physical, mental, emotional, social, and spiritual well being of the child or of any individual. So, to the viewers, I would say, please always keep this definition in mind because it is really all encompassing. It is a holistic view of health and not just physical health, which is what most people think when we talk about health. For the physical health, I would say to you, I already mentioned, but I'm going to say it again, 5-pronged approach to good health, whether it is for you or for your child. One is history, medical history, physical examination, laboratory and diagnostics, health information, and health counseling to guide the patient along the correct path to physical health. Obviously, same would apply to mental, social, emotional, spiritual well-being. And I'm very happy to say that spiritual word was added later. And I think all of us must know and understand that that is the true path for all of us. And we must inculcate that in our children even as they're growing up. And I would say to you, for parents, you asked me overall well-being. So I think for parents to understand that they are parents and not their child's friends. So parents, others they would be called friends of children, right? But we call them parents. So parents have a different and specific role. They impact the child's life immensely. So children are like clay, chikan mati in Marathi we call it. They can be shaped. And if parents were to understand what parenting is all about, it would make a very deep impact in the child's life. And very briefly, just out of curiosity, interest, do you know what parenting styles are?
No.
See? So I also asked you a question. So parenting styles is how do you really go about parenting? So a lot of research was done on this, and they came up with 3 criteria. Warmth, how much warmth is there in the family? Firmness, sachat gharat, discipline kiti. And third is restrictiveness. So restrictiveness is a negative criteria where there is psychological control. So just very briefly, some of the parenting styles are authoritative. So I would say I had an authoritative parenting, meaning as a child. So this is a household where there is free communication, independence, high on warmth, high on firmness. That means guidelines are given to the children. Ki this will do, this will not do. But no psychological control, no restrictiveness. So these children who grow up in such households with authoritative parenting show the best results on all counts, on education, on socially, career-wise. The best outcomes are with authoritative parenting. The second is authoritarian parenting. What is authoritarian parenting? Army style. ये करो, अभी उठो, ये नहीं करना है, वो नहीं करना है. Bas, no discussions. This is my rule. So this parenting causes a lot of issues with children who suffer a lot of stress and anxiety and depression also. Then you have another, tell me when to stop talking, okay? But the third I would say is indulgent. Indulgent parents, you all know, these brats as we call them, who take out fast cars and create accidents on the road because they have indulgent parents who say, no, let him do what he wants. They're high on warmth. It's not that they don't care, but they don't put firmness in place. So whatever goes. So that can be a little dangerous. And then you have indifferent parenting. In indifferent parenting, the household revolves around the parents. Child is a sidekick. Parents don't even know where he's going, what he's doing. Indifferent to his, somebody is there to take care. And the lifestyle is around the parents, which is again very bad because it causes a lot of disruption in the family life and it causes a lot of abuse also. So that is there. And just one other parenting style I would mention, a helicopter parent. I think you'll understand. I should also call it drone parenting. Okay, so helicopter or drone parenting where they want complete control all the time. मेरे बच्चे ने क्या खाया, ये क्या, किधर गई, इधर गई, ये गए. So that psychological control is not good for the child. So that briefly is what I would tell parents, that you must study your own parenting style and see what changes you need to make. And last but not the least, and I would say to parents, is you are your child's role model. कभी भी भूलना नहीं. आप अगर बोलोगे कि healthy खाना खाओ और आप दिन भर you are eating unhealthy food. If you get angry all the time and you tell them, बच्चा don't get angry. If you are stressed and tense, you say, why are you not smiling? What is there for you? We are giving you everything now. Doesn't work. If they see elders being treated badly and they talk to the children, you must respect your elders. Okay? If they see you being petty, selfish, fighting, and they say, why are you fighting with everyone? So what I'm trying to really tell you is a role model is what you are for your children. Respect that. Your actions talk louder than words. Avoid conflict in actions and words. It will go a long way. तो बात बिना किए तुम बच्चे को काफ़ी कुछ सिखा दोगे. बात करके कुछ नहीं सिखाने वाले. It is just the way you live, and I'll go back to my parents and I'll say the way they lived their daily life is what I saw and learned from. And that is the same message I would like to give parents.
That's
Great.
That's really
Okay, thank you.
Truly. Can you describe the challenges you face in running a multi-speciality hospital?
Yes, indeed. It was challenging. It is challenging because we were earlier a uni specialty. That means it was either maternity, mother and child. So transitioning to a multi-specialty requires more investment, more challenges, more promotional efforts, and a whole lot of jing bang which is not there in the uni specialty. So our hospital in Pimple Saudagar, ONP Leela Hospital, is largely women and child. Even in this hospital, which is in Shivaji Nagar, we largely do a huge section is mother and child or woman and child. And then we've added on specialties. And our thought here was that our patients who've been coming to us for years on end obviously have other complaints, and we should be able to, as their doctors for many years, cater to all their medical needs. So that has been, yes, it is challenging. Easier to run a uni-specialty than a multi-specialty.
Definitely.
Yes. Yeah.
In what ways do you connect with the community and spread awareness about pediatric healthcare?
So I'm glad you asked me that question. So we do mega free health camps at both our units, the one in Pimple Saudagar and one in Prime also. Then we do specialty community programs, which could be for say joint replacement or infertility IVF. So many programs like that. But herein I would say to you that what we have done, that's my husband and me, his name is Dr. Avinash, what we did from 2000 to 2014 was a charitable joint venture with the Pune Municipal Corporation. We took over one of the hospitals and we took that hospital over as our give back to society. So it was for mother and child, and we ran it for 7 years completely through our own funds. And I would say here that no, we did not garner funds for our trust, but sponsored it entirely because we felt that society had given us a lot as doctors, blessed us a lot, and we need to give it back. And what better way to give it back than to serve the community of patients, which is women and children, who have been our blessing. I would say that was charity from the heart, and I still say so. And to date, we do a lot of charity for medically needy patients. But we to date have not really looked at funding, but now I am looking for funding, and I'm going to tell you why. So you go on with your questions. Yeah.
How do you stay abreast of the industry trends and adapt them to your hospital?
One is you need to have a keen observation of what is happening in the medical world. So various ways, of course, you do your own reading, but you go online, and I would always be searching for medical innovations. Okay, what is new in medical equipments? I attend huge exhibitions in India and abroad. Say like you have Arab Health, I was just there a couple of months back. Then you have Medica in Germany, and in India you have so many, wherein there is showcasing of innovations, equipments, and the new trends. And of course, always in touch with huge, big companies who keep making newer equipments, modifying them. And that's the way I stay abreast of this.
Please share any key insights you have gained as a pediatrician and a hospital owner.
It's a long question, but I will give you some answers, some points rather briefly. One thing that I've seen as a pediatrician, and I want to share this with all the parents who are viewers, is the immense love that parents have for their children. What they understand love is a different matter. For them, love would be feeding my child his lunch every day, watching the TV is also love for them. So, but don't question the intention. The intention of parents is pure and noble. And I would say to children who are watching this, is that do not question your parents' intention and love, because it is very, very pure. And yes, it may sound irritating, but you must understand that they always mean well for you. I've seen this, that when they get the child into the examination room and then they place the child on the examination table, they're just looking at the child with such immense love. Ki, "Arey to basla." Then when the child obeys the commands, they're very proud. So I'm saying these are very subtle and small things, but the love that the parents have for the children, honestly, hats off to them. Yes, so that's one thing. Second, I would say, is being a pediatrician and like a doctor and a hospital owner. I think life is all about relationships, and relationships, the more we delve into it, the way we penetrate them in our daily life, understand them, creates inner transformation for us. And I think what I enjoy as a doctor is the number of people I meet as a hospital owner, because each of them contributes in some positive way, and even if there's some negative way, there is something positive coming out of it. And I think that is the beauty of being in practice and being in the heart of things, where you're in constant touch with people. human beings cannot be socially isolated. They have to live. So from times immemorial, we've had tribes, then we've had villages, then we've had communities and so on. So that relating, I think, is given me very valuable insights as a person. The third thing that I would say, what I've learned and I observe, is all human beings want to be accepted, appreciated, applauded, awarded, and rewarded. And one must respect that at all times. Creating jobs for people and contributing to their livelihood, I think for me is a fulfilling experience, and it adds again value to my life that I can impact so many lives, right? And I think these would be the brief insights that I have. And repeating my values again when I relate with people is Seva Bhav, Sadbhavna, Sahakarya or Sahyog. I have also observed and learned that whether you are a doctor or a hospital owner or a business owner or whoever, I think to be good at what you do, you need to be a good human being. That is crucial to all our lives as human beings, business owners, whatever. And I think sometimes in the day-to-day firefighting and everything that goes on, we forget our core human values. So that is something that these relationships always remind me of, which is of course peace, Atmabal, purity, knowledge, truth, there's Gyan, Satyata, love and compassion, happiness and bliss. I think all of you would agree that these are actually our core values. Yes? So, yes. Does that answer your question?
Definitely.
Thank you.
Yes, what are your long-term goals and how do you plan on achieving them?
So in this elderly care space, I am looking for social entrepreneurship and of course charity, wherein I can build the elderly care homes of my dreams. So that is one long-term goal. As a hospital, of course, I have learned that setting up too many hospitals in the same city doesn't work, and this is my learning curve, my learning lessons that have happened. So today I feel that a hub and spoke model is what I would look at, is the hub being 1 or 2 units in the city and the spokes being areas where the populations are increasing. So like we set up our hospital in Pimple Saudagar in 2017, recognizing that there was a huge population spurt in that area. Similarly, to go to areas where the population is there and create a hub and spoke model with growth over the next 5 years. So this is briefly professionally, and like I said, the quest to be a good human being always.
Yes. Ma'am, any advice you have for our Pune Mirror viewers?
Advice indeed. And who am I to give advice, but I'll try. Okay, now people, I think the younger generation doesn't want to commit. So you're hearing words such as situationship. So I'm like, hello? Okay, but it's happening. So my small advice is, please take the risk. I'm not, sorry to sound like I'm advocating marriage, but I'm just talking about relationships. There's also people who are believing in live-in relationship. So how is it different from marriage, right? If you're in a live-in relationship, legitimize your relationship because you're living in society. Okay? I would say here, if it's okay in Marathi, is that समाजाला पण मन असतं. समाजाचं मन राखून तुम्ही तुमचं करा. Samaj will always respect you. And this is my little advice to the younger generation. The second thing, they don't want children. And herein I would come with the joy of parenting. In fact, at ONP hospitals, Oyster and Pearl hospitals, we have a tagline, joy of motherhood, which I have now changed to joy of parenthood. That relationship, I would say to you, is the purest of the purest. The second advice to women is, just because you get married, don't give up on work. If you believe that society is going to give you a second chance, it is not. There is nothing like second innings. You just lose that time when you want to work. So these are my few words of advice to the viewers across the younger and the married age group and to women in general. Happy Women's Day.